So
Okay.
how does we actually study and how would we able to assess the growth rotation? What we have to do, we had put certain mini pins within the bone, within the core of the mandible, and we would be assessing by the superimposition. So here you have to have the understanding of the superimposition. What exactly is the superimposition? You have taken the radiograph at a given age. For example, this is the mandible border from the radiograph at a given age. For example, let's talk about 12 years of age. What we would do with the same standardization, we will be taking the radiograph at in subsequent years, let's say 14 years, 15 years. So what actually superimposition is that we would be placing another radiograph exactly over the initial one and we will see the changes. For example, we see the lower border has moved to this point. So this we would be able to see by superimposing the x-rays which have been taken afterwards over the initial one. Okay, just like you see in this
Okay.
photograph, we see that the initial x-ray is taken and then in the post-op the x-rays is taken in the later stages, and the difference in the margins and the changes that you will see, it will be more apparent to you when you will superimpose the later x-ray over the initial one.
Yes.
Okay,
Okay.
so what is happening that by doing the superimposition you could be able to understand the growth rotation. So what has happened, you have placed the pin in different areas of the mandible and you had taken the radiograph lateral side, and then you would take the radiograph after certain years after the initial x-ray, and now you would be now you would see the changes in the position of these pins. If these pins initially were on these places and in the later x-ray afterwards you would see the position of the pins are here.
Okay.
Initially, I have explained it very clearly. We need to see the core of the mandible. Okay, so we had placed the pins in within the core of the mandible that are unaffected and uninfluenced by the functional activity of the surrounding muscles, so that are not disturbing the core of the mandible. So the initial the lines were like this, and the after few years the line is something like this. Sorry for the poor drawing. So you see the change in the position of this line because the core of the mandible is actually rotating. So what would happen if the core is rotating like this? Thus the posterior part is moving downward and the anterior part is moving upward. So what would happen as this posterior part is moving downward? This will lead to the increase of the posterior facial height. And if this part is moving upward, this will lead to the decrease of the anterior facial height. So what would happen as a consequence of the this type of the rotation in which this posterior area is moving downward and the anterior area is moving upward, this would lead to the increase of the posterior facial height and decrease of the anterior facial height, and that would develop a low angle patient, a hypodivergent patient. So now we are discussing that why the pins are cannot be placed in the functional matrix in the functional process of the jaw. The reason is if we place the pins in the functional processes of the jaw, the functional process growth is completely dependent upon the soft tissue. So there would be an increased influence of the soft tissue, okay, on the functional processes. That's why we have to skip the part of the functional matrix theory, and we need to select those areas of the bone that are unaffected by the muscular activity of the surrounding muscles. So that is the reason we cannot place the pins that are studying the growth rotation in the functional processes of the jaw.